So today we're going to talk about upper motor neuron and lower motor neuron injuries. We'll talk about pertinent exam findings and show you examples of these things found in upper and lower motor neuron injuries. We'll also talk about pertinent patient complaints as well and where you find these things in the neuroaxis. So looking specifically at upper motor neuron injuries, you would expect to find lesions in the brain all the way down to the spinal cord, peripheral nerve lesions starting in the roots all the way out to, if you look at the tips of the hands, that's where you would expect to find a lower motor neuron injury. So the corticospinal tract is made of two motor neurons. There's the first order neuron, which is going to start with its cell body in the cortex. It'll travel down and synapse in the anterior horn in the cord, where it'll synapse on the second order neuron, which will exit through the roots and then travel out to the periphery. Upper motor neuron injuries are going to occur when there's an injury to this primary order neuron, and then the lower motor neuron injuries will happen with any injury to that second order neuron. In upper motor neuron injuries, exam findings and symptoms you might see in the acute phase are things like numbness, weakness, hypotonia. Reflexes can be variable depending at which point you're actually evaluating the patient. Over time, as this injury becomes more chronic, you'll see things like stiffness, spasticity, muscle cramping, numbness, rigidity, and the reflexes tend to become more hyperreflexic at this point.
In lower motor neuron injury, in the acute phase, you tend to see numbness in a dermatomal or peripheral nerve distribution, weakness, hypotonia, and areflexia. In the chronic phase, you tend to see numbness, weakness, hypotonia, hyporeflexia, muscle atrophy, and fasciculations.
First, we'll demonstrate a lower motor neuron injury. You'll start with observation, looking at bulk and tone. Comparing the left to the right side, you can see an example of thenar eminence wasting.
Next, we will test strength. So on the left side, when we test strength with a lower motor neuron injury, you can see that he has 5 out of 5 strength. And on the right side, where the injury is located, you can see weakness. Next, we would do the sensory exam, and we would test pain, temperature, sensation, and proprioception, and look for deficits in the distribution of a nerve root or plexus. Next, we will test reflexes. So on the left, you can see normal 2+ reflexes. On the right, where he has the lower motor neuron injury, he has no reflexes.
In an upper motor neuron injury, you'll see clear differences in the exam findings. Most notably, you'll see signs of stiffness and spasticity, most demonstrable by this lack of ability to relax. Reflex exam will also show hyperreflexia. You'll want to complete the exam by doing a thorough sensory examination of vibration, position, sense, pain, and temperature, as well as checking motor strength.